Do your patients tell you that their pain continues to worsen without any known reason? This can be both confusing and disheartening for them, as they may have tried a variety of different treatments, but nothing seems to work. They may even tell you that their life has become a lot smaller because their function has decreased over time. Well, in this video, I'll let you know the real reason that chronic pain worsens, so you can make your patients aware of this and help them to stop this decline in function. Hey friends, welcome back to the channel. If you're new here, my name is Mahin and I'm an advanced physiotherapist specialising in pain management based in the UK. On this channel, we explore lifestyle strategies and tools to help people manage pain and create healthier and happier lives. Although I work in pain management and my patients come to see me because of their pain, they actually report that they accessed our service because of the secondary impact that the pain is now having on their lives. I've done a previous video on the boom bust cycle and ways to overcome this cycle, so check that one out after this one if you haven't already watched that. But today I'm going to cover a different cycle, the pain cycle, and the impact that avoidance has over time. So here we can see the pain cycle, which I'm just going to go through now. So at the top here, we have pain, okay? And because of pain, we have a natural fear or a worry or a concern that that pain is going to get worse or that we're going to do something to flare up that pain. And this is very common for patients. Because of that fear or that worry, which is natural, okay, it's a normal worry to have, it leads to an avoidance of certain activities over time. And usually those activities are the ones that are most painful. Again, a very normal response to pain. Because of this activity avoidance, what happens over time is we have a decrease in strength, function, general fitness, and we have increased sensitivity to that activity. Now, when we're not able to do activities because they're painful, that also has an impact on the way that we're feeling and our mood, and that can lead to low mood as well. Now, all of these things, so reductions in functions, increased sensitivity to activities, and also low mood, all lead to pain again. Don't forget, pain is our protective system that responds to anything the body sees as threatening, and a reduction in function, physical capacity, increased sensitivity, and low mood are all seen as threats by the body. Pain responds to that, and that cycle continues going round. I use this cycle in clinic every day, and I actually have it drawn out on a bit of paper or on my tablet because I know that I'm going to speak to various patients throughout the day about this cycle. In fact, it's so common that at one point my colleagues actually knew exactly which clinic room I'd been using that day because they'd walk in and they'd find this pain cycle either drawn on the whiteboard or on a scrap bit of paper. Key point to take away from this pain cycle is that the more that we avoid a certain activity, the harder and more painful it will be when we have to go back to that activity. And in a simplified way, this is how the pain or avoidance cycle leads to increased pain over time. The reason that I'm covering the avoidance part of this cycle first today is because as a physiotherapist, it's usually the part that I can have the most influence over. So if we can have an influence over patients, avoiding activities and help them to gradually expose back to those activities, then that can have a knock-on effect, a positive knock-on effect to other parts of the cycle as well, which then leads to a snowball effect of improvement and reduced pain over time. Now that we've covered the basics of the pain cycle, I'm going to go into a more detailed version that was done by My Live Well With Pain. I'll leave a link to the My Live Well With Pain website in the description below, and there's some great resources on there for both clinicians and for patients. So similar to the last one, what we start off with persistent pain at the top. Okay. And as I mentioned in the last part, we kind of broke down this little bit here as I talked about the fear of worsening pain and so on. But ultimately that leads to patients becoming less active and avoiding activities because of that fear or that worry of pain. Pain is not a nice thing to push into, so it's very understandable why patients avoid activities that are painful. But over time, as I mentioned, it leads to a loss of fitness, muscle strength, function over time, and that activity levels gradually decline then over time. Because pain and sleep are so closely linked, we can also get sleep problems. So if there's more pain in the day, then understandably, there can be more pain at night. And if there's more pain at night, that stops people from sleeping as well. And we know then the next day after having a bad night's sleep, pain sensitivity can increase. Okay, so it's often found that if people have had a bad night's sleep, they are in worse pain the next day. And if they're not sleeping as well, that leads to more fatigue and tiredness, lower energy, and so on. Another effect of reduced sleep or reduced quality or quantity of sleep is increased anxiety, stress the next day. And we see this a lot of the time. And if you're anything like me, if I have a bad night's sleep, I'm quite irritable the next day. And it's the same with pain. So if a patient has a bad night's sleep, their nervous system is quite irritable the next day. And if their nervous system is irritable, their pain system is more irritable. And obviously this can lead to more stress, anger, frustration around their situation, around the pain and the impact it's having on their lives. Coupled in then with the poor sleep and the pain and the reduced activity, we also then have side effects from medications. So a lot of my patients that see me will be on at least one or two different types of medication trying to manage their pain. And if you're seeing patients with pain, it's probably common that you see patients on a lot of different medications as well. But one of the most common side effects of medication is also drowsiness and fatigue. So that just adds into the basket of already these symptoms that patients are experiencing, and it just kind of heightens that even more. Plus there's other things like, nausea that you can have, shakes, weight gain. There's so many different side effects of medication. And the next thing here in the cycle, again, you can see is weight gain. So a lot of patients come to me and they have a goal of weight loss, but they also want to manage their pain. And it's a bit of a catch-22 because the medication is kind of helping with their pain maybe, but it's making them put on weight. And maybe the increased weight then is increasing neuroinflammation, which is increasing pain sensitivity. So in a bit of a catch-22. So it's really important that we find other ways for patients to manage their pain apart from medication. There are so many things that we can do to manage pain. Medication is a very small part of the overall pain management picture. Now I'm going to couple the next two things together because we've got negative thinking or fear about the future, and I kind of covered that already a little bit, but also depression and mood swings. So everything that we've spoken about so far within this cycle can obviously lead to low mood, depression, and so on. It's very, very, very common that you will see people who live with a long-term condition. I'm not just talking about pain now. That might be diabetes. It might be, stress, poor sleep, insomnia. It might be heart conditions. But people with long-term conditions often have a diagnosis of depression as well. It's obviously very difficult to live with a long-term condition, and it has an impact on mental health. And we know the relationship then between mental and physical health as well. Another thing to consider is when people are experiencing pain, they may not be working anymore, and because they aren't able to work or do the job that they used to do, then that can lead to financial concerns and financial stresses and worries about the future. How are they going to manage if they can't work? Are they going to have to, claim benefits for this? Are they going to be accepted for benefits? A lot of chronic pain conditions, the diagnoses are not that specific, and unfortunately still a lot of chronic pain conditions are not recognized or taken seriously, which is a massive shame because we find that there's a group of patients who are unable to work, but they aren't able to get some support financially as well. So that leads to more stress and worry. And even if they are able to get support, maybe it's very different to the income that they're used to when they were working. Like with any long-term condition, of course, our health is the fundamentals to everything that in life. So our health underpins everything. And one of those things that underpins our relationships, because if we don't have enough energy, if we're in pain and so on, that can really start to affect relationships, whether that's intimacy with a partner, whether that is the ability to look after your kids to the way that you want to do that, spending time with your children, looking after parents as they get older. It can really start to have an effect on the wider things in life. The way to think of all of these things that we've spoken about in this cycle is we have pain, okay? People come to see us because of pain. Pain can be represented as a stone, okay? You throw that stone into some water, okay, and there are always ripple effects. And those ripple effects are the secondary effects the pain is now having on people's lives. And we can see from this cycle just what a vast array of issues can come up just with pain in the center there. So it's really important when we are looking at this is to help patients realize this wider picture and the things that might be influencing, their pain experience, but also having a look at ways that we can help patients, because we can probably come in at all of these different stages in the cycle and offer some sort of help or treatment with that. So this pain cycle here is the real reason that chronic pain worsens over time. It's not usually because of one cause, but rather a cycle of different events and experiences that patients go through that leads to worsening pain over time. And we can see this a lot of the time because what's seen on scans and tests often doesn't change over time. It doesn't change from day to day. It doesn't change from month to month. It doesn't even change from year to year a lot of the time. But pain is seen to be worsening over time. And that's because of this pain cycle. So it's not because of damage, because we know that a lot of the time, for most of chronic pain, pain does not equal damage. There are lots of other factors that influence pain. Pain's our protective system, and anything that body sees as threatening, pain responds to that. And this cycle is a great demonstration of that. So this is a very, very common cycle that happens to most people who are experiencing chronic pain. In fact, I have brought the cycle up with hundreds of patients now, and I don't recall having one that ever said, they didn't feel what was on that cycle. Every single person said that they saw their own experiences within that cycle and could resonate with that. So the real reason that chronic pain worsens is not because of one specific cause, but rather a continuous cycle involving lots of different factors. As I've mentioned before, everything matters when it comes to pain. The good news is, because this is a cycle, by having an impact or improving one area of that cycle usually leads to a knock-on effect and a snowball effect and improving other areas of the cycle as well. If we take a look at that first cycle again, it's not just as easy as saying, okay, well, let's just stop avoiding things and get back into everything, because pain is still going to very much be there and be a massive barrier. There's also learnt behaviours from months or years of pain that will still be dominant here, so it's not as easy just as flicking a switch. But where we can come in is, okay, fine, we might not be able to help with the pain straight away. We know that there's no one fix or cure for chronic pain. And we know that we're probably not going to be able to influence that fear or concern or worry straight away either, because your patient is a human at the end of the day, and that is a very normal thing to experience, that fear and that worry. Where we come in is those activities that are being avoided. How can we gradually, and gradually is the key word here, help patients to reintroduce those activities again so they become less sensitized to them? And by gradually exposing to those activities, what we should find is we have an improvement in function, strength, fitness, and also we have an improvement in mood, because we're helping patients get back to the things that they enjoy and love and things that are important to them again. All of those things lead to less pain over time. We grow with confidence, there's less fear, and that cycle then starts to reverse and go the other way. Just to reiterate, pain does not mean damage, and it's really important to let our patients know about this before we start gradually exposing to an activity, so we can set expectations, because it's very likely that when they go back to an activity that they will experience a slight increase in their pain. And sometimes it's a bit of an experiment to know what level is right when we're returning to activity, and letting your patient know this is normal, that they'll experience a bit of pain, is helpful, because they know that they're not doing any harm or damage. And actually it means that the gradual exposure is going to be more successful, because they have those expectations already set. And as I mentioned before, this gradual return to activity must be gradual, because this is what's going to help reduce the pain sensitivity related to that activity over time, and it's going to help to calm down that nervous system when that person is doing that activity. To ensure you're getting this gradual return to function right with your patient so that they don't experience flare-ups and setbacks when they are gradually increasing their activity levels over time, check out this next video on 3 life-changing hacks to manage pain and fatigue. Thanks for watching, take care, and I'll see you next week.